So evolution is nature, and nature is evolution, and so has phacoemulsification. Phacoemulsification has evolved in two ways. One, as far as the surgeon is concerned, the surgeons themselves have evolved when they are doing the surgery. And second is the machines which are doing the surgery, or through which the surgeons are doing the surgery. First of all, when phacoemulsification was started with, that was like roughly about 20-25 years back, the machines were extremely basic and the surgeons were extremely basic. The surgeons didn't know how to go about it. We hardly had any textbooks to go by, and we didn't know exactly how to do the surgery and the nuances of the surgery. Over a period of time, we've been learning a lot, and more textbooks have been coming up, and then as more and more people are learning phacoemulsification, the techniques that have been defined by the doctors and the surgeons, they have been improving and evolving considerably over a period of time. I also remember that, one of the first phaco machines that I was using, after each small step in the phacoemulsification, I had to wait for about 3 to 5 minutes in between the steps for the vacuum to build up in the phacoemulsification machine. So each surgery with the older machine used to take roughly about 1 to 1.5 hours to do a simple cataract surgery. Now with the newer machines, it's just probably about 5 minutes and we are done with the surgery. Even the improvements in the surgery which have been, which we do with the newer machines is far more superior. That means we have much clearer corneas. This means that the patient can see clearly the next post-operative day. We also have much better chamber stability. Chamber is the front of the eye which needs to be stable without collapsing itself. So this chamber stability has been extremely good in the newer phacoemulsification machines, thereby reducing the complication rate drastically. So we have far fewer complications with the newer machines with better post-operative outcomes. Phacoemulsification has the advantage of, most importantly, giving good post-operative vision. When we do surgery through the conventional method, usually the size of the incision is pretty large. We take anything between 6 to 8 millimeters of the size of the incision. Now with phacoemulsification, we can even get away with doing an incision of just about 2 millimeter, which is almost about 1/3 to 1/4 of the size of the surgical incision that we used to put. So when we bring down the size of the incision, this also means that there is less trauma to the patient and also better post-operative outcome as far as the patient is concerned. And as far as surgeons are concerned, phacoemulsification is beneficial to them as well, because it gives much better reliability of the result and repeatability of the surgery. For example, if we do 10 surgeries, all the 10 surgeries will look more or less very much similar when we do phacoemulsification. Whereas with the conventional surgery, a small misstep would have caused a lot of difference in the outcome of the surgery and thereby to the patient's vision as well. We as Indians are extremely cost-conscious, so are our patients obviously, because we are not among the developed countries where the disposable income is very high, and then more importantly, the insurance doesn't cover all the surgeries, or even if it covers, very few people in India have insurance to cover them up. So we used to be away from phacoemulsification mainly because of this reason in India. Now as we are discussing, the cost of the machines is dramatically low. We get machines, good quality machines, for as low as about 8 lakh to 10 lakh rupees. And also the cost of the intraocular lenses, as the numbers of the lenses that we implant has gone up, so the cost of the lenses also has come down, thereby making phacoemulsification a more affordable surgery for everyone. In fact, a very surprising thing is there is a state government scheme in Karnataka which is called Yashaswini scheme, which is a very successful scheme, and the Yashaswini scheme runs on a very low insurance cost to the patient, and this scheme covers phacoemulsification free of cost for every patient. So this means that again, even a patient in a rural area, a farmer, can come to a hospital, avail of Yashaswini scheme and get a phacoemulsification done free of cost and go out of the hospital happy.